Awesome, Dr. Windsor. Really incredible and exciting what's on the horizon here. I have a few questions for you. And first, want to ask you just in terms of the administration of these, what's the process? Is a pet admitted for observation? Is it just outpatient? And also, is there a pre-med that's involved? What's the process?
Yeah. So for currently right now, we just have all of our medications that are in clinical trials. And so the process for a clinical trial protocol is a lot more stringent as far as the monitoring. But I will tell you the ultimate hope, when we have products available is that you have a dog that needs it. You either have it in the hospital, you call and get it shipped. It comes frozen, you thaw it at room temperature. It gets diluted in saline and it gets administered IV, usually over the course of 5 minutes or so. And then you just watch to make sure they're not having any sort of reaction to the therapy. I'd say those are pretty rare, but if you do, it might be like a transient nausea or something. For some animals, we're probably going to have people just give Serenity or something with it, you know what I mean, just to kind of help prevent, any sort of nausea. But especially for dogs, reaction to it seems to really be extremely low, so it would essentially be an outpatient. You could watch them for a short period of time and then they would go home. What we need to learn more about is how many doses to give, right? So right now, a lot of the studies are using 2 doses. You saw that very first study just used 1 dose. And so it's hard to know over time, like, do you just give 1 and then see if you give more if they need it? Do you stick with this kind of 2 doses? So I think we'll learn a lot more, over time. What I will say, though, that it's really important for people to understand about stem cell therapies is that, again, because they're trying to work with the body's natural immune system, to, reset and repair, it can take some time, and so it's not like a lot of other medications where people are used to, I give this thing and then it blocks that thing immediately, right? So it takes a little time. So, oftentimes we're looking to see improvement over the course of weeks. For some dogs, they actually feel better pretty fast, but we just kind of have to teach veterinarians and pet parents to understand, you just got to get a little time to see if it's going to work, and so in a lot of these cases, the improvement is happening over months. It might not necessarily be over the first couple of days. So,
okay. And what type of volume? Is it on a syringe pump or what's the volume?
Yeah, so that can be variable depending on your product and your particular protocol. I'd say currently for our products, we're typically giving between 5 and 10 mils of total volume. That is just given directly into a catheter. So no syringe pump, no fluids. It's similar to like if you would imagine you need to give a dog like an IV antibiotic injection or something, or any sort of other slow IV injection. It's very similar to that. So they really just need a catheter. You don't need any special equipment or anything.
Awesome. And so the clinical trial that you guys are conducting, what's the time frame for that? How long are you going to be doing that?
For sure. So we have, just a set number of cases that we want to enroll to complete the study. And so right now we're probably going to have it open. My suspicion would probably be through middle of next year. Usually the best way is just contact us and then we can kind of find out, depending on geographical location, where you're at. Sometimes we'll help set up new clinics to become clinical trial sites. In some cases, we have sites in the area that we can just have patients referred to be enrolled in the clinical trial. A lot of owners can take it on themselves too. If they find it on their website and be like, hey, I want to be enrolled in a trial, contact us. Is there anywhere near me that I could go, for a trial, and we can direct people that way. So a lot of it's very fluid depending on cases. And sometimes you'll have a big bump, we'll have a bunch in a row and then things slow down. And because allergy season can be cyclical, sometimes you'll have a big group in allergy, more of an allergy season, and then things will slow down a little bit.
So to that end, is it possible that someone would actually get enrolled off season, perhaps when they're not on less medications?
Yeah, so we basically have to verify a certain severity of the lesion scores and stuff to kind of enroll in the study. And then, yes, I mean, the ideal would be patients who are on no drugs, like new atopic dermatitis patients would be perfect, right? And then the other situations are drugs where we're able to kind of get them off of their drugs. What we don't want to do, though, is like falsely represent their lesions either. And this is why this disease can be challenging to study, right? Because you have this cyclical nature. So we don't want to create a false population where we're just happening to get them in a good month, right? I mean, it seems like things are working better, So for that reason, our clinical trial team has like pretty strict parameters for enrollment, into the trials. But those are the trials, right? So once you get out in the real world, there's a whole difference we know about real world, medications than there are clinical trials. So again, in the real world, you don't have to get them off of all of their other meds to be able to use stem cells. You can incorporate it in. And so the hope would be if we, can get through the process of getting an FDA approved drug, and then that's more available to people to kind of use as needed.
In terms of cost, about what we might be looking at for treatment?
Although I can't give specific numbers, I will say, at least for our company, our goal has been to make this affordable for people. So the last thing we want to do is go through this process, get drugs approved, and then people can't afford them, right? And so I think when you take into account the cost of chronic medical management with cyclosporin, Cytopoint, et cetera, it'll probably be less expensive to use stem cells, assuming that they're going to be effective. But they might not be effective for everybody, right? And so that's the thing too, is that with all of these medications, they all work in different ways. They all have potential. We would love to know which ones are predicted to do well and ones aren't, but some of them won't. Some of them aren't going to have a response. So it's one of those things where, it'll be just the responsibility of the veterinarian to work with a particular, owner and patient to kind of decide what they want to try, But again, I think part of the message we want to get across is that our ultimate goal is to cure disease, if we can, and not just continue to live in a world where we block things, what I mean? Block the body from doing what it's trying to do. We work with the body to help it get better, what I mean? So that they not only just feel better, but they actually get better. And so that is one way that I think stem cell therapy is different, than a lot of the other therapies that are out there. But it's going to take a while to get veterinarians and owners and stuff to understand that, because we're so used to doing the same stuff. And it's scary to try something new, right? So if you've been trying something that you feel like works, why would you want to try something else? So it's a lot of really just trying to get people to understand. And a lot of drugs that, cannot be used together, that's not the case, for stem cells, we can incorporate it in. So.
Well, it's exciting to think about regenerative medicine is taking a role in helping to potentially cure. Would you say cure?
Oh, yeah, that's the goal, right? That is the goal. So that's, you're regenerating. That's kind of the definition. You're regenerating and repairing tissue. And it's really nice to really feel like you're kind of part of a movement now. Like this isn't a fringe therapy anymore. Like this stuff is coming, and the hope is going to be just like you have all of these other things sitting on your shelf. You also have your stem cells sitting on your shelf, or you can order it and get it whenever you need it, to incorporate it. So it's just a really exciting time to be part of this in veterinary medicine. And we're following so closely behind humans. Like in human medicine, regenerative medicine and stem cell therapy is just exploded. Like pretty much anything you can think of, you can find an indication that they're studying it in humans. So it's really nice to be able to kind of follow in that path, and also to have so many diseases that are so similar, between animals and people, that we can use both to learn from what they're doing, but also to be animal models, for humans with these various conditions and stuff as well. So a lot of what they'll use and they publish in human publications, they're taking stuff from us, right? They're being like, hey, in this particular dog model, this did this. And so it's just really exciting, to be a part of all that.
Yeah. Well, I thank you very much for accepting the invitation to share this exciting information. It's a wonderful addendum to our program, and excited to stay in touch with you, because I know over time we're going to be maybe meeting more to talk about regenerative medicine and its applications. So until then, I thank you, and keep up the great work.
Thank you so much. Yeah, reach out if anyone has any questions. So.